In this video, we will be going over techniques and tips on how to measure a deviated finger for a lateral support splint. The lateral support splint should be used on fingers that have a deviation of 20 degrees or less, are passively reducible to neutral, and the joints are not enlarged and do not have nodules. For enlarged joints, fingers with nodules and deviations greater than 20 degrees, you should consider using a boutonniere splint with the spacer worn on the side. Before you start measuring, it is important to talk to the person and find out if their fingers are feeling normal or more swollen. If the fingers are swollen, it will affect measuring in the final fit of the splint. Understanding if they have fluctuations in size can help when deciding between a larger or smaller easy sizer. Some people even need 2 sets of splints when they have flare-ups and swelling. To measure for the lateral support splint, we will be using the Easy Sizer tool. The Easy Sizer tool has rings that have been designed to mimic the exact size and shape of our rings. Numbers referencing the sizes are located on the tabs, and alternating ring colors indicate whole and half sizes. The small swan neck holder is used to put 2 Easy Sizer rings together to form a trial plastic splint to slide on the finger. To start out, find a proximal size that is snug sliding over the joint and when angled rests at 45 degrees. The tab will sit at the volar crease of the joint and be vertical or perpendicular to the finger when the ring is at a 45-degree angle. Go up or down in trying on sizes until you come to one that seems to fit well. Detach it from the cord and set it aside to use later in the holder. Follow the same procedure for the distal ring to find a snug but comfortable ring that will rest in the opposite direction at 45 degrees. Then detach the distal ring size from the cord. Now let's create a trial splint. Using the swan neck holder, insert the tabs of the rings you have chosen so the rings are facing away from each other and create a 90-degree angle. If you are unable to insert the tabs all the way to the base of the holder may be upside down. The holder is symmetrical, so it does not matter which ring is on the left or the right. Once you create the trial splint, slide the large end on the finger first. Since the trial splint is plastic and does not have the lateral support on the side, passively correct the deviation with your hands to position the splint on the finger to evaluate the fit. If either of the rings is too tight, remove the ring from the holder and choose a bigger size. To determine if the ring is too loose, keep the finger straight and lightly press on the side of the splint. If you see a lot of gapping between the finger and the ring, then the size may be too big and you will want to try a smaller size. Once you find a size combination that fits well, record it on the order form. For lateral support splints, decide which side the support should be on, or if the support should be on both sides. The support goes on the side of the joint opposite from the direction of deviation to act as a fulcrum point. The rings on the other side of the finger are the 2 counterforces correcting the deviation. This is how you measure for a lateral support splint. If you need any help or have any questions, please visit our website at www.silverringsplint.com or feel free to call us toll-free at 1-800-311-7028. Thank you for watching this video, and we hope it has been informative.